And welcome back into Open Line. Chuck Long here with Dr. Richard Horwat from Bluegrass Endodontics. We are talking about your mouth, your teeth, your gums, the way you brush, flossing, tooth infections, all kinds of things on this. And if you have a question, as always, we love to hear from you. The number you can call is right there on your screen at 615-737-7587, 737-7587. Don't have a lot of time left, so if you do have a call or comment, make sure you get on the line with us quickly. We were talking about something as basic as a toothbrush, you know, what kind of toothbrush, how often you brush, and that sort of thing. But another kind of basic principle when it comes to your mouth, flossing. So some people say, I never floss. Some people, I know I have friends, I used to be this person. I would floss the day before I went to the dentist. And so you get in there and the dentist says, do you floss? And I could at least honestly say yes. I didn't say, you know, once in between now. Now I floss every day. And what's your advice on flossing?
You know, we've had that debate, you know, do you floss before you brush or do you brush before you floss? And, you know, the other day I brushed my teeth, I started flossing afterwards, and one of my staff members even said to me, you know, hey, you know, you're supposed to floss before you brush. And I thought to myself, I didn't know that.
Yeah,
you know
there's
what I mean?
that debate.
I can make an argument for both ways, you know, and I don't floss nearly as much as I should either. You know, I don't think there are people that claim that they floss every day, and I definitely don't do that, but yeah, I floss when I feel like I need to floss. If I haven't flossed in 1 or 2 days, you know, I'll go in there. Nowadays they have those little tiny picks that have a little flosser on it. And I can just fly through it really quickly,
right,
and things like that. But yeah, you should floss before you brush every time.
Now, which is good to know. But when you are flossing, there's two things a lot of times that can happen, or different occasions. Sometimes you have sensitive gums and you floss, and I've heard both arguments of, if your gums are sensitive, flossing is helping, so continue flossing, just be gentle. So what's your view
You
on
do
that?
want to go, you know, I watched a show not too long ago. There was one show where a dentist was talking, and he had said that he was giving directions to how to floss, and he says, and you don't want to go underneath your gums, and I was kind of surprised he said it, but you do. You want to go underneath your gums. It's what it's for. When you are going to floss and you have the thread going between the teeth, one thing you don't want to do is you don't want to saw back and forth. You can definitely cut a groove into your tooth, but you want to push against one tooth, and you want to go down basically until you meet resistance. You don't want to force it down to go deeper than it can go, because you're likely to cut something, but you want to go down to where the floss really wants to go. If you have dirt and debris that's deeper than where you're meeting that resistance, because you have an area of your gum line that's going to stop the floss, then you may need a deep cleaning. You definitely want to floss when you want to go up and down against the tooth. You want to go to the next tooth and scrape up and down against the tooth. And if you feel like you're not getting down the degree that or if you feel like there's more debris that may be trapped underneath of there, then you should see a dentist and make sure that you don't have anything periodontally going on.
Okay.
But basically, you do want to go down till you meet resistance. Go just underneath the gum line. You definitely don't want to push and force anything.
And then the second part of that question, what if your gums are bleeding when you floss?
Bleeding gums isn't such a bad thing. You know, you don't want them to bleed, but if they're bleeding, you probably got some dirt and debris out of there. You know, they're going to bleed because they're inflamed. If they're inflamed, it's because there's dirt, debris, bacteria there. And so after you're done flossing, you're going to want to brush your teeth, of course. If the bleeding doesn't go away, and after 2 or 3 days and you're still doing this, it's still bleeding, you want to consider seeing the dentist and find out what's going on.
Okay. All right. So we are going to go from flossing and toothbrushes back to the root canal. So what are the signs for people just tuning in that you need a root canal? How does someone know?
Main sign is pain. Pain will kind of get you in there. You know, people get new crowns, they get new fillings, the tooth is sensitive afterwards. You know, sometimes the dentist is trying to be a little bit conservative, which is great. And they're being conservative with treatment, and the cavity may be a little bit deeper than they had anticipated, and it may cause you some discomfort. So if you're in pain, another thing is you can go in for routine examinations. If you go in for routine examinations, sometimes you won't have any symptoms whatsoever, but we can look and see that there's likely an infection on an x-ray, or it's implied by the x-ray. And that's because the tooth may have died over time, an abscess has developed, and it hasn't really caused you any symptoms yet. As we were talking about earlier on the show, even though the bacteria is there, the right stimulus hasn't really come, it didn't really come along yet to really kind of wake you up. But sooner or later, it's going to wake you up, and they know it's better for you to get that done before those symptoms come.
Okay, well, that is good to know. Now, when you have a crown or a cap, does that necessarily mean you won't have to have a root canal or not?
You know, every time you get a tooth capped, you don't necessarily have to have a root canal. About 15 to 19% of all teeth that are crowned will die over time, and you will need a root canal. I think it's great that the general dentist is trying to avoid the root canal. If they remove everything and there's no symptoms and they're able to put, you're in a temporary and everything's going smoothly and they put that crown on there and you didn't need the root canal, that's great. But every time you do get a root canal, especially on a molar tooth, almost every time at least, you are going to be better. It is better for you to have a crown on that tooth. You need to have a crown on that tooth after the root canal to protect it.
And then I think sometimes people think, and it's probably the myth, but that crown, it's damaging the crown when you're doing the root canal, but you save the crown when you do the root canal.
Technically, the integrity of the... You save the crown. Yes. Okay. The integrity. We can go through the crown to do the root canal. We have to make an access hole to do that. The integrity of the crown, of course, is compromised because you put a hole in it. But we do put a permanent filling in there afterwards. We are able to restore the crown. It's not exactly where it was, but it's just fine. It's not going to cause you any problems down the road. If you do have problems down the road, it won't be because you put a hole in your crown. I just know that if I had a crown, I would prefer to have a crown without a patched hole in it. But it's not a big deal at all.
Okay.
It's not a big deal at all, and it certainly isn't not an aesthetic concern whatsoever.
Okay, well that is good to know. So what about cracked teeth? I mean, sometimes people, you get a little, whether it's a sliver or more of a big crack. Is that something you always need to go see the dentist about?
Not always. If you look close enough to your front teeth as well, you'll find little microfractures in your teeth. Most of them are enamel, only through the enamel deep, and they call those craze lines. And they're usually there. They don't progress anywhere. You might chew on ice, you have something warm, you have something cold, you get little microfractures in your enamel. If you do have a fracture on a lower molar tooth, sometimes you have an amalgam or a metal filling down there and you have your everyday chewing, and those lateral forces from the crown might put a microfracture in there. The fracture may stay superficial, it might not go deep at all, but kind of like having a crack on the windshield of your car. Everyday driving, everyday trauma from driving, that fracture may grow across your windshield, and it can do the same thing on a tooth. It can kind of climb and find its way down to the tip of your root. And normally when that happens, you get to the point where the tooth isn't fixable anymore and the tooth would have to come out. There's many times every day that we'll access a tooth, and when I'm in there under a microscope, I can see fractures on the inside of the tooth that were from the outside that are deep enough to go on the inside, and I have to make a judgment call whether or not I think that fracture is, well, you're going to be able to keep the tooth with that fracture. But oftentimes you can get a crown restoration after the root canal, and that crown will protect that fracture and it won't grow on you.
Okay, good to know. What about technology? What in the area of technology has made your job easier?
Everything. We do everything under microscope technology now. Anesthetics are better these days. There's electric pulp testers. We always try things with ice. The endo ice is what we call it. The refrigerant that we use is probably the best detector of whether or not you need a root canal, but sometimes if it's giving you false positives or false negatives, we'll go to what's called an electric pulp tester. You mentioned fractures. There's dyes that you can put on teeth to where it'll show the fracture where it is. Technology is wonderful, I think, in our profession. There's not as much discomfort. Topical anesthetics are a lot better. Even everything from the chairs are more expensive. We give our patients something to rest their jaw on. Our patients don't even need to open their mouth anymore. We give them something to rest their jaw on, and I probably have a patient snoring almost every day that I work on them. So it's just a much more comfortable procedure.
I like to hear that. Saying that means you're very comfortable if you are in near sleep in the dentist chair.
Yeah, I love it when they snore. It makes my life a lot easier. I don't have to worry about them squirming or anything like that. Sometimes a patient might move a little bit, and under a microscope, a little bit is a mile.
Yeah.
So I have to readjust, focus, and turn knobs and stuff like that, but it's not a big deal.
And talking about technology, as far as crowns are lasting longer than they used to, correct?
Boy, oh boy, I can't count how many different types of crowns you can get out there, whether they're an aesthetic crown. Some of them are made for aesthetics, some of them are made for function. Some of them are just made to last. And they have these crowns out now where they're all porcelain. They're made of a material called zirconium, and it is just unbelievable. I mean, it's even drilling through them. I used to be able to just use one drill bit to get down through the porcelain, another one to go through the metal framework. But these ones are all porcelain, and I'll burn through. I'll call them drill bits. They're actually burrs, but I'll go through 3, 4, 5 drill bits just on one crown to get through it because it's so strong. It'll heat it up fire red.
So now they're going to need technology to increase the drill bits life so that they can last a little bit longer.
They do that, but then they want to charge you a lot of money for those drill bits. Files are very expensive. It's not cheap.
All right, we're going to take a short break. When we come back, we will tell you how you can get a hold of Dr. Horwat at Bluegrass Endodontics. So come on back with us.
Nice.